Welcome back. Here to talk more about hormone replacement therapy and diet is Dr. Gino Tutera from the SottoPelle Center. It's good to see you, Dr. Tutera.
Hi, how are you?
Very well. You know, a lot of people, we were talking about this whole thing where they're working out, they're eating right, and they still can't lose that little pouch. And you said it kind of comes hand in hand with the whole aging hormone.
Yeah, as we lose our capability of producing, especially testosterone, your muscles can't, burn carbohydrates the way they used to. And it allows your body, unfortunately, to continue holding this fat on. And you work hard, and pretty soon you get discouraged, and you say, "I might as well just go get a banana split because I'm working so hard." And I get to this, and what happens is people will hit a wall, and they call it a plateau, but they really hit a wall because their body can no longer burn the fat at the proper rate as they had when they were younger.
That's just part of life. It's just not going to happen.
It's not going to happen until you get your hormone levels up to where they were when you were in your third decade or early fourth decade of life. Because at that point, as your hormone levels and your capability of producing them goes away, you're going to have less and less success with weight management, fat burning, and exercise tolerance as well. And
then you get discouraged and you just give up.
Yeah, and you get depressed.
Yeah.
I get depressed.
Absolutely. So talk about how that works. So if you're one of those people out there who's eating right, exercising regularly, and it's just not coming off, they go to you, and it starts out as a simple blood test, right? And
we do a hormonal analysis on individuals, and we also are skilled in interpreting things. Just I had a patient the other day came in and says, "Well, my doctor says these are all normal," and I said, "Yeah, they're all normal if you want to be 70 years old, and you're only 50, and so therefore, by reestablishing a better physiologic state, Remember the last patient that we had here, Mrs. Tone. Remember Tone Bonoff was here, and she just reported back to me that she says, "Now I've lost 10 pounds where I was at 5, and I've lost 10 now, and I've lost inches, and my trainer thinks that things are working so successfully." And the reason they're working successfully is, once again, her physiology, her internal physiology, is once again normal. So when you work so hard at trying to be good and do the things that you're supposed to do, you'd like to see results. And if you don't have the proper physiology, you can't get the results.
And, it's true. When you're younger, you work out a little bit, the weight comes magically off. Then we're getting older. It's like this and it's so discouraging and upsetting because you're working so hard and you're eating better than you've ever eaten. I'm working out more than I've ever worked out, and it's still not. It's like, wow, this is taking forever.
Yeah, it is. And you remember when you were 20, if you had to lose 20 pounds in 3 weeks, it was pretty much all gone. Now it takes you 3 months to 3 years to be able to take that weight off because you're no longer physiologically as capable as you were.
And then doing a bioidentical hormone replacement therapy, there's other side effects or good things that you might notice. If it's not just for weight, you'll notice other things possibly?
Yeah, especially as far as mental clarity. Remember we talked about depression. The relief of depression comes because the brain needs hormones to be able to make serotonin. And that's why so many people wind up on Prozac and all those drugs, because of the fact that they help keep your serotonin level up in your brain, whereas your hormones help you do that when you're young, to do that consistently and continuously. And to really have it work, you need to have the hormone there all the time. And that's why some of the natural hormones, when they're given in cream form or pill form, may not have the same effect.
That's what I was going to ask you. You do the little pellet that goes into the skin, right? That does a slow release.
Right.
Do you have to, once you get that, do you stay on that forever?
You can if you want to. Sure. I mean, if you're really feeling well, and it's all about quality of life. If you don't have a good quality of life, who wants to live till they're 90 or 100? But if you have a really good quality of life, why not live to 90 or 100 and be able to hike and walk and play a little golf and enjoy yourself on a cruise without having somebody to have you walk with a walker?
But with the little pellets, they just kind of stabilize those testosterone levels, and then as the pellet disappears, do those levels go back down again?
Yeah, but not like when you put a cream on where they shoot way up and then they shoot down. The nice part about this is that your body actually controls the release of the hormone. It's if you think if this is a pellet and you place it underneath the skin, as your heart pumps blood across this, your body becomes like a kid licking a lollipop. That's how simple it is. So as you're exercising, your heart rate goes up rapidly. Well, you're going to get more hormone. And when you're sleeping, you don't need as much.
I see.
So it goes slower, and so therefore you get hormone appropriate to what your needs are.
Oh, I got it. Okay. I didn't know that. Very interesting. Lots of information there. Thank you so much.
You're welcome.
Good to see you. Dr. Tutera has some more exciting news that you'll share with us the next time you
Yep.
come. It involves a book and some other things. But we'll share that next time, right?
Yes, absolutely.
All right. Good to see you again.